Case scenario. Miss Carrie Ann is the mother of a 5-year-old male child, Jimmy. Miss Carrie Ann called your office, and the office connected this call to an on-call physician, who is you. In this station, you are expected to 1. Ask Miss Carrie Ann exactly what makes her seek medical help. 2. Identify a possible etiology of the current problem. 3. Suggest to Miss Carrie Ann what would be the next appropriate step for her and her child. 4. Write a patient note. And B. No physical exam or differential diagnosis needed. Announcement. SPs, please get ready for the next encounter. Examinee, you may start your encounter now. Door opens. Dr. Lee enters the room, sits next to the telephone set, presses the call button, and starts the conversation. Introduction and history of present illness. Dr. Lee. Hello, this is Dr. Lee, one of the on-call physicians. How are you doing? Miss Carrie Ann. I'm doing great, doctor, but my son, Jimmy, is not feeling well. May I ask what happened to Jimmy? Oh, he has been vomiting for the last 24 hours. He cannot keep anything down, has lost interest in eating anything, and actually looks rather weak now. Oh, really, Miss Carrie Ann? I'm sorry to hear that. What do you mean by he is rather weak? I mean, he does not really show interest in anything, not even his favorite TV shows. He sleeps most of the time, and whenever he wakes up, he says he feels sick. Can you describe how the vomitus looks? It was just the food he ate to start with, but now it looks kind of watery. How often is he throwing up? Almost every hour, and immediately after I give him some food or drinks. Any particular color? Any blood in it? Not really, but the last couple of times I saw a greenish hue in it. Review of system. Dr. Lee. Miss Carrie Ann, are there any other symptoms he is having besides what you just told me? Like what, doctor? Does he have a fever? I think he was a bit warm last night, but I have not checked his temperature. He says that he feels cold. Any tummy ache? No. Miss Carrie Ann, did you notice him being disoriented or confused? No, Doc, he is just weak. How about neck stiffness? No, doctor. How about his stools? He has not passed any stools since yesterday. Actually, I've not seen him going to the restroom at all. Now, Miss Carrie Ann, is there anything you would like to add at this stage to what we just talked about? No, that is about it. Past medical history, growth, development, and immunization. Dr. Lee. Let me ask you about his health in general in the past. Were there any health issues when you were pregnant or while Jimmy was born? No, it went well. It was a natural delivery. Anything while he was a baby or toddler? Is he up to date with his shots? Nothing really, Doc, except some cough and cold episodes. He received all his vaccines. Does he go to school? Yes, he's in kindergarten now. He mentioned that he celebrated his friend's birthday yesterday. Apparently they had a French apple pie. He loves apple pies. Miss Carrie Ann, did you hear about anybody else in his class being sick? I have not yet called the school. Miss Carrie Ann, did Jimmy have any surgeries in the past? He had a fracture fixed when he broke his right arm 2 years ago. Family illness, social history. Dr. Lee, how is the family doing? We're doing okay. He's the only child and his dad works at a construction company most of the time. Allergy and food intolerance. Dr. Lee, is he allergic or intolerant to any food or drink? Not that I know of, doctor. Case summary and appropriate advice to the caregiver. Dr. Lee, Miss Carrie Ann, based on what you said, I believe your son might have contracted what we call acute gastroenteritis. I'm not sure exactly what caused it. One explanation could be the birthday party he just had in his school. Sometimes children develop a tummy flu related to a virus infection. I cannot be sure at this stage, but would certainly like to examine him and run some basic lab tests. Would that be okay with you? Yes, doctor, but isn't there an easier route than this? How about if you call the pharmacy so they can fill some meds for him? Miss Carrie Ann, I understand it has been hard for you to travel here, particularly in the context of your husband being busy. But it is quite hard to make a clear judgment over the phone about exactly what is going on with Tim. I assure you that I will be able to see him as soon as you arrive here at my clinic. But sure, I can call the pharmacy so they can provide you with some oral rehydration solutions that you can use on the way. Okay, doctor, I will see you in the next 2 hours. Sure, Miss Carrie Ann. Please take my contact number so they can page me when you get here. It is X1234. Thank you, doctor. I appreciate all your help. It is my pleasure to help you. See you soon. The SP's feedback to Dr. Lee. SP. Good morning, doctor. How are you doing? I'm doing great, madam. How about you? Not bad, doctor. Well, how do you think you did? I think it was an interesting case. That child had too much apple pie at the birthday party. I think I nailed it. That very well might be, Doctor. Yes, you did well. You communicated very well, sounded caring and concerned, and offered me enough help. Is there anything you would do differently next time? I did not ask if you had a ride to the hospital. Good point, I actually did not. We had one car, and my husband always uses it for his work. I am also 9 months pregnant, and do not feel like leaving home. Oh, yes? Anyway, Doctor, Jimmy was also complaining of a headache, but I forgot to mention that to you when you asked me if there was anything else. Also, at one point, you asked me a couple of questions at the same time. I think you asked how Jimmy is growing and the status of his immunizations. I was thinking about which one I should answer first. Also, a couple of times, you addressed Jimmy as Tim, but that is okay. I knew what you meant. Besides that, you covered everything. Thank you, madam. There is always next time. Oh, no, I mean, you did wonderfully. You addressed 90% of my concerns, and you will certainly do well in your exam. All right, thanks. You have a great day. Final remarks. This audio compendium has provided you a basic idea on what constitutes the actual encounter between you and your SP. Remember, for best outcome, you will need to practice similar cases multiple times. This can be done with your friends, colleagues, or family members. If you would like to have more comprehensive review materials for USMLE CS preparation, refer to the book titled Core Concepts for USMLE Step 2 CS, written by the same author.